Medical privacy, like all our other forms of privacy, it's an issue I take very seriously. If you don't have adequate safeguards to protect your privacy, a lot of Americans aren't going to seek the medical treatment they need for fear that somehow their health information is going to be disclosed without their consent, and they might lose a job or they might be turned down for a promotion. Likewise, unless you have some real privacy safeguards in place, the healthcare providers who see the privacy risks associated with electronic health records and see it as being inconsistent with their professional obligations, they're going to avoid participating in a national healthcare system. Now, we all have heard these kind of rumors during this healthcare debate that the bills that are being considered are going to use medical records to restrict our individual rights, like the right to purchase a gun, or to limit the ability for individuals to receive treatment from their doctors. Well, that's not the case. And this Vermonter would oppose efforts to try to undermine patient privacy. After all, for more than a decade, I've worked to make sure that meaningful health privacy policies are part of our national health care system. Just recently, I worked with the late Senator Kennedy and Senator Baucus to make sure that meaningful privacy safeguards for electronic health records were put into the American Recovery and Reinvestment Act. And that bill includes several of my recommendations. Every one of them is designed to better protect Americans' health information privacy, including, and this is very important, including giving every American the right to access his or her own electronic health records, but also the right to timely notice if there's a data breach, make sure they are notified right away if it involves their health information. And I would also put very critical restrictions on the sale of sensitive health data. We need to do this so that people can be sure that their privacy is protected. So during these coming weeks, I look forward to working very much with the lead sponsors of healthcare reform legislation in the Senate and also with President Obama. I want to make sure that this legislation contains adequate privacy protections for every one of us as Americans.